Good afternoon. It looks like we have opened at 12 noon. It's our webinar time for the Flint Community Webinar on Coronavirus. We certainly want to welcome each one of you that have joined us today. We're excited about the information that we'll be able to share with you today, and we look forward to your participation. Today, we want to just start off again by saying this is a wonderful opportunity for us to share great information about what's happening here locally, to put our local context on what's happening during this corona pandemic. I am appreciative of all of our participants and our panelists. So on behalf of the Healthy Flint Research Coordinating Center leadership team, we welcome you to this webinar today. As you may know, we've said before that the Healthy Flint Research Coordinating Center is a collaborative effort between community and our academic partners at Michigan State University and the University of Michigan, Flint and Ann Arbor campuses. I am excited today to be your moderator. My name is Yvonne Lewis, and I am the co-director of the Health Flint Research Coordinating Center, along with being the director of outreach for the Genesee Health Plan, as well as being community principal investigator for the Flint Center for Health Equity Solutions. And as a CEO for the National Center of African American Health Consciousness, it is important for us today to realize that these issues that we're facing today are so incredibly important, and yet they are so incredibly challenging. We've talked from time to time throughout the last few weeks. Now, this is our 6th webinar about how difficult it is for us working at sheltering in place. And we just heard a little bit earlier today that our governor has requested that we shelter in place a little bit longer. So one of the things we want to take a few minutes to do this morning is to take a little bit more time to breathe and talk about our mental wellness. This is a real critical piece for us as we are planning our daily activities. And so we'll hear a little bit about that. We'll be introducing other speakers to you today. Our panelists will be here to answer questions. We're also going to have a quick Q&A time with Dr. Deborah Holden. Another special guest we have with us today is Isaiah Oliver from the Community Foundation of Greater Flint, Clarence Pierce from the Hamilton Community Health Network. A number of our other panelists will be speaking, and we'll close today a little bit differently than we've done in class, but we'll close today with a call to action, hearing from Dr. Susan Wolford. So I just want you to take a moment and sit back and relax, because we're going to now hear from Dr. Jennifer Johnson. Dr. Jennifer Johnson is a real leader in the mental health world in our community, and she is also a representative of Michigan State University here on our campus. She's a Charles Stewart Mott Endowed Fellow. Charles Stewart Mott Endowed Fellow for our department at for today. So Jennifer, please, you see I need a little mental health help. So come on, Jennifer, and share with us.
All right. If I could have the next slide. Or can I run them?
No, that next slide will come up for you.
Okay.
But if you just please begin by sharing with us.
Yeah, sure. So, I was going to say that, just acknowledge that this is a hard situation, right? It's a hard time. We all know this. Everything from grief to being with your whole family in a small space, or I've heard people say they're worrying about family members who are sick and others who won't stay home, and that it's not affecting everyone in every community equally. It's hard. Next slide. Next slide. Here we go. So the point is to make fun where you can. Laughter is good medicine. Here's some self-care bingo. And, these are good things to do. I'm going to give you 10 or 15 seconds. And if anyone has a bingo, put it in the question. I want you to actually attend to the things you're doing to take care of like I said, if you can find that you got a bingo today, you could mark it in the question and answer, or just in general, you know, keep mind of this to do a few things to make sure you're sleeping, drinking water, eating food, trying something new, having fun. Next slide, please. When the next slide comes up, oh yeah, so there's a few things, you know, and I've heard this, it's scary because the families, you know, if your loved one is sick, often you can't go into the hospital with them. And I've heard stories about people being really concerned because an elderly loved one went into the hospital, but it's hard to advocate for them from afar. I heard one story in another city of someone who was very concerned about their elderly loved one. They didn't refuse to have the person tested. The family member who was outside the hospital tried to get the hospital not to discharge him, couldn't do it. And they said, oh, he doesn't have COVID, he's fine. And he ended up passing of COVID. So, you know, if your loved one starts to feel sick, the advice was to, you know, call your primary care doctor right away. Sometimes the hospitals will listen to a primary care doctor if you have one, when they won't necessarily listen to family members. Get your loved one a smartphone, show them how to call or video chat if they don't know, and send it with them. And if you have somebody, you know, if they lose consciousness or something, have the person that you're sending in there clearly give the hospital permission to talk to specific family members and friends, so that they can advocate for the person if needed. But like I said, if you're having trouble, sometimes your primary care doc can get through when you can't. And I also, there's some advice for grief down there. I wanted to make people aware, you can share this with your constituencies. There's a COVID-19 support group that includes both just stress, but also grief and other things related to COVID. The information's here. It's Thursdays, every other Thursday for youth and for adults. And then if you go to the next slide. And when it comes up, this is always our, oh, I got it. Yep. This is always our reminder to breathe, and here 30 seconds today, just to breathe. And I'll make it play. Or whoever's running the slides, if you could click it for me. Hey, we got somebody with the bingo. Good for you.
Thank you, for sharing with us about that. I do want to say we are living in this technological age. And even when we're watching the major news programs, with all of us using these technologies, it is delayed. So we're having one of those moments. So it gives us a good opportunity to just kind of breathe, as you said, and continue to move forward with our session today. But as you said, we do have a bingo, and so that's a great thing. So thank you for participating in our bingo today. So Dr. Jennifer, who is a Charles Stewart Mott Endowed Fellow. I got it right this time. So if you could just, Dr. Johnson, just take us through that 30-second.
Yeah, sure. Yeah, so and the idea is just to slow down and breathe. So we can start doing this, and then you can just keep doing it as you listen. You'll be surprised how much better you feel. So go ahead and breathe in. And breathe out. And breathe in. And breathe out. And breathe in. And breathe out. And you can, like I said, you can listen and do that simultaneously. So just keep doing that. And congratulations to Dr. Bailey, who wins self-care bingo.
We do have Isaiah Oliver with us today, who is the Chief Executive Officer of the Community Foundation of Greater Flint. Isaiah, it's so nice to have you on the line with us today.
Oh, man, it's great to be here. I'm looking at this picture you have of me. Look at me looking slim.
We found you. We found you right in the heart of the city of Flint. So Thank you, Isaiah. One of the things that I know the Community Foundation has done for a while is organize and galvanize our community around some major issues that have been happening. One of which you've also been really a key in organizing funding and then creating spaces for us to talk about some difficult issues, particularly with racial healing. You took that task on. So can you first talk to us a little bit about the Flint Emergency Relief Fund that you've put together?
Yeah, so we've had a lot of activity as promised. The last time we were on the call, we said we would be actively raising money and then quickly dispersing. And so I guess the update today is that we've reviewed about $2.7 million in requests, and most of them were amazing requests. But as you know, we couldn't fund all of them. We raised about $1 million. So 91 proposals reviewed, about, not even about, I'm going to say $1,000. We have about $240,000 left in the fund, and we are meeting 3 times a week, reviewing 6 to 15 proposals every meeting. We got a 9-member advisory committee that's looking at those things every night and then coming back with their thoughts the next day. We're hoping to raise more resources because we know there are more needs than there are resources available, but we're continuing to push through. Most of the made in this first round have been like the highest priority urgent relief, which is food, water, and basic essentials for those folks that are most vulnerable in our community. We were hoping to get more to funding volunteers, although we did have the opportunity to fund the 9 hub sites that exist across the city or across the county, and with some significant grants. We were hoping to get more into school and some of those programs that are necessary for kids that are learning remotely. But to be honest, the priority right now has been getting food, water, and essentials to those folks that are shut in.
I think this is so important because, again, we've talked about this before, how we hear what's happening nationally, but it's so important for our community members to understand there is work being done right here in our community that's working to meet the needs. So thank you for that work. Can you talk to us a little bit more about the process? What do individuals or organizations, I should say, what do they need to do in order to be eligible? Is it go on your site? How do they find out?
So 501c3 organizations, like most of our grants, nonprofit organizations are our partners in this space. There are a number of amazing nonprofits in our community doing amazing work. So it was no shortage of organizations to reach out to and work with. We've tried to make this one a lot more simple than our traditional process. So there's a 2-page application. I mean, it doesn't take you very long to get through, very short budget, very, very short on the narrative end, but really focused in 3 areas. 1, getting urgent needs to people who need it the most. So water, food, and essential items. Building capacity of some of those nonprofits that don't have the capacity to do the amazing work that they're already engaged in. And then building, I would say, volunteer capacity for those groups, which has been interesting provided we're on a shutdown. So now we're having to find more resources to pay folks who would typically volunteer to be in those spaces because they're the front line. And we know the statistics, we've been listening to it for the last 6 to 7 weeks. Those are the folks that are risking their lives to make sure the least of us actually get the resources that we need. And so we have to find ways to pay and cover the cost. So that's been the 3 areas we focus in. But again, 46 nonprofits later, out of 91 proposals and $2.7 million in requests, we've been able to get some resources out, but not nearly enough.
So it's important for us to keep looking and figuring out ways that we can be supportive, and you're continuing to accept donations. Is that correct?
We're continuing to accept donations, and I'll be honest, we're continuing to accept proposals because the better proposals we get in, the better we can tell the stories to those folks who have the discretionary resources that they can support us. They want to know what's happening in our community and how we're meeting the needs. So we're also still accepting proposals. You may get a letter to say that we don't have resources available right now, but know that we're actively using those stories to go out and raise money for our community.
Thank you. So there's no loss of effort here. So even if you're not funded first round, you're saying that those items that are presented in those proposals are being considered as a way to identify new funding.
Yes, they are. So I send people to see, I'm being old again, cfgf.org. Because when I say www, my 9-year-old reminds me that I'm getting old. So cfgf.org, as soon as you get on there, there's a site, there's a bill at the very bottom that tells you how many proposals we've taken in, how many grants we've made, the list of all of the donors that have given, and all of the grants that we've made out. So everything is available, including the application to apply.
Thank you, Isaiah. And we did put your website on the bottom of the screen, so people can pick that up. I want to
There we go.
because even in that leadership of providing the resources, you're also helping to look at the issues our community so deeply. So can you talk about this Greater Flint Coronavirus Task Force that has been set up through your organization?
Yeah, I mean, you said earlier we were doing some work related to truth, racial healing, and transformation, really the relationship building process, the debiasing process that's necessary for us to really come together in our community. And as we were doing that work, and we were alerted, you're going to talk to Deborah a little later, and you talked to her earlier. You talked to her a little earlier, you're going to talk to her later about the state task force. I was amazed that the state took that step to really galvanize around what we're all seeing right now is a disproportionate number of African Americans, of people of color impacted by this crisis. The numbers across the state are clear. I mean, they came out very early. 13% of our population are Black, but 43% of the cases were people of color. In Genesee County, the numbers aren't very different. We represent 20% of the county, 43% of the cases, and 51% of the fatalities. We've got to do something. We have to be intentional about not only the preventive strategies, but also the protective strategy, the engagement strategies, the treatment, all of that. And if we don't have a group of folks that are coming together, holding the institutions responsible for providing that care for the folks that are most vulnerable, then we're being irresponsible as a community. I'm going to get off I was thinking about my talking points. I'm just going to be straightforward. We're being irresponsible if we're not responsive to what we see as the immediate need in our community. We thought it was important for us to pull folks together, but once these folks get together, they're going to be doing the hard work of ensuring equitable access, protection, and resource allocation for all residents while being intentional about those folks that are marginalized and disproportionately impacted.
That is so very, very important, because if we do all of these things and we don't look specifically at those issues that are creating the conditions that we see, they do repeat themselves. And so I appreciate you saying this is going to be a working group. They're not just going to be sitting on the sidelines. They're actually going to be working. So thank you for that.
We need, I'll tell you, and I know you're about to pivot to Dr. Deborah, but I'll tell you, we need folks, some accountability partners. We have them in our families. We have them in our faith institutions. We have them in our close social groups. How do we start creating accountability partners in this work? Whether we're talking about business or philanthropy, or we're talking about health, both clinical and public health, how do we start having organizers as a part of the conversation? How do we start having our faith leaders as a part of the conversation? Our business leaders working with our philanthropic leaders, because beyond, and I know it's important that we're thinking about today of COVID-19, but there's a post-COVID economic thing that's going to happen, reopening that's going to happen. How do we ensure equity in the post-COVID reopening of our economy? We've watched over history, Black and brown people be left out of the stimulus or the stimulating of the economy post-war, post-flu. We got to make sure that we're centering racial equity in that post-COVID recovery. And so that's also an important part of the work that we're doing.
What you're saying is so incredibly important. And I know sometimes this conversation gets very, very sensitive, because when we raise the issue, then it's like, why are we pushing on that? Why is that such a big deal? But if we don't raise the issue, we see the difficult aftermath, the devastating aftermath. So one of the things you said, and I just want to go back and have you just tell us how you want to see this happening, because many people are saying, I didn't get selected to be on the committee, but I want something to happen. I want to be a part of that conversation. What are you saying? You said you want the faith leaders. You say you want community activists. How do we get involved?
So I'll tell you, we were intentional as we were looking to create the first, and right now we're at 23 task force members. You get 30 and then you start getting a little dysfunction, but we got 23 task force members, and they represent folks from across the spectrum: faith, public health, clinical health, business, philanthropy, organizing community, the nonprofit community. And we're hoping that we're going to create, and our first meeting is on Monday, so I'm jumping the gun a little bit. We're hoping that we're going to create some subgroups that are really doing the meaningful work in between those meetings. That way we can actually move the needle, one, on some broad interventions, but also on supporting policies that actually create the space or the groundwork for an equitable community. And so we're going to be doing both. We're going to be influencing policy decisions at the state level, at the federal level, and hopefully the local level as well. But we're also going to be doing a lot of work around interventions that are needed tomorrow to ensure that we protect these populations.
Today we're going to be doing a little call to action here and there. So I thank you for your input. So it's a call to action. If those of us that are in community, and for those of us that are on this webinar, if you see spaces or you hear or you know of a person that's on this task force, tap them on the shoulder and ask them, tell me when I can come to a conversation with you and be a part of this, and let's make it happen for our community.
Yes, that's great. Thank you so much for having me.
You're welcome. And so that does take us back to Dr. Deborah, because she's on the state task force. And so she can kind of help us now make the link between what's happening at the state and what you've already shared with us, Brother Isaiah, for what's happening here locally. So Dr. Deborah, did we get that technology figured out?
It's not a technology, it's an internet connection. I don't know if you guys can hear me. I'm doing my very best over here. Can you hear me?
Yes. Well, I'm sorry, because I called the internet technology, so forgive me. I hear you. Yeah, so it's not, we got these internet connection issues in our little area. So thank you for coming back.
I know, and little known fact, we live right across the street. So I'm like, how is she not breaking up? Anyway, I'll be super brief. Very similar to what Isaiah is standing up through the Community Foundation, the governor implemented this task force. We actually began meeting a few weeks ago. I think the task force is really trying to, at a state level, start by one, increasing transparency. I do applaud Michigan. We were one of the first 3 states to produce data and make it publicly available on COVID case and COVID death disparities. A lot of other places were experiencing this, but they weren't actually putting the data out. So Michigan was sort of one of the first places to do that. And I think the goal is to continue to do that, but to let that data then be our guide for what interventions we need to now take. This is not one of those things where we want to be able to replay the tape when it's over and figure out what we could have done. This is about mounting real-time interventions at both the state and the regional level that are going to help us to turn the tides, both on the epidemic overall, as well as deal with the fact that we have clear disparities and who's being exposed and the kind of treatment that they're getting and the recovery process for those people. So I think that's sort of the big push of the state. And I do want to really applaud Isaiah and the many other leaders who've come together for the local task force, because I think the efforts that we built from the ground up are going to be really critical. And I think they will also inform the state on how to actually mount an appropriate, equitable COVID-19 response. So I think the two things working together is going to give us our best bet to turn this around.
Thank you, Dr. Deborah. It's nice to know we have the links so that we can make those connections. So again, I want to encourage all of our participants on this webinar, if you know someone, as you hear and we see the announcements, tap that person and ask them how you can help share with them so they can be your voice at that table. Now, as a part of the discussions that we've had, I want to remind you that if you go to the bottom of your screen, you see that Q&A, our panelists that have been with us every week, and I want that to be seen, that our panelists are here with us today to answer questions. So if we go to we just want to show you who the panelists are that are on the line with us today. They're able to answer questions. So as you're listening to the information that's being shared, please post those questions and we'll do our best to get those questions answered for you today. One of the things that we were asked about was testing. And so many are concerned about the limitation of testing that was made available. We have with us today, Clarence Pierce, who is with Hamilton Community Network. We're gonna spend the next few moments talking with, and I call him Brother Pierce, Brother Clarence sometime, because he's this tall, stately gentleman that commands respect when he steps into the room. But he's been leading the Hamilton Community Health Network for a number of years and has made significant inroads to providing services to those who are in need. The federally qualified health clinics are ones that can get resources and provide services that in our communities that many cannot. So Brother Clarence, welcome today.
Thank you, Yvonne. It's good to be with you.
Yeah, we've had a lot of conversations getting prepared for today. Well, what we've been able to do is get some additional testing for us in our community. So can you tell us about what's going to be happening with Hamilton in the next week?
Yes, Yvonne, we're really excited about it. We are going to be starting up one of our testing locations on the north end of Flint at our North Point location located at Clio and Pearson Road. We will be starting on Tuesday. We will start from 10 to 2 on the first day. We're trying to get things in order and make sure we have a smooth operation going. But from that point on, we will be starting up at 9 in the morning and going till 4 in the afternoon. And we'll be operating 2 days a week, Tuesdays and Thursdays. And the following week, we will be starting up at our Burton location on the south end of Flint. So our goal is to try and test as many people as we can throughout the city, and we want to be able to provide those tests for people on the north end and on the south end of Flint.
Now, Clarence, what you're sharing with us is really important. I want to ask you if you could, can you turn your mic up a little bit? Because I want everybody to hear everything that you're saying.
Yeah, okay.
You're making sure that even people on the north end are going to be able to get this testing. So I just want you to tell us one more time. You talked about Hurley, Hamilton, North Point.
Yes.
That starts up this coming week?
That starts up Tuesday
Okay.
at 10 o'clock in the morning, and we will run through 2 o'clock on the first day. And, you know, naturally on the first day, things tend to happen that are unexpected. But from that point on, we will be operating from 9 in the morning until 4 in the afternoon. So
Okay.
our intent is to test as many people as we can. But there is a process, Yvonne, and I'll go through that process with you so that the listeners will be able to understand just how this thing works. First of all, we have a Hamilton COVID-19 hotline, and that hotline number is area code 810-406-4019. So anyone who may be experiencing possible symptoms or just want or feel like maybe something is going on, they need to call that hotline. And once you call that hotline, you will be transitioned into one of our providers who will then make an appointment for you. Once you get the appointment, and in that appointment, the doctor will go over some basic things about your symptoms or lack thereof. But in any case, you will discuss what your situation is with the physician or the nurse, and you will then be given an order, or an order will be actually submitted for you so that you can get tested. And in that process, you will be given instructions and educated about the process, how it works, what's going to happen, and will be directed and scheduled to actually come over to the test. Now, this is a mobile test, so you don't even have to get out of the car. You just drive up to our North Point site. You will be directed. First of all, we're going to get your information. We need to know that, one, we set up an appointment for, if it's Sister Yvonne Lewis, we just want to verify that it is her, and we will verify that information and move you on to the test, whereby nurse will then give you the test, and you will be directed about what happens after that test. Now, it takes about 2 to 3 days to get the results back. And so as soon as we get the results back, we will naturally contact you immediately. Now, we have gotten some questions about, well, you know, what if I'm not a Hamilton patient? Well, if you're not a Hamilton patient, when you contact the doctor for the appointment, all of that will be explained to you. That doesn't mean that we can't test you, but we will go through the process of what that means as having another PCP other than Hamilton. Not to say that you can't switch, because we'd love for you to switch over to Hamilton, but if that's not the case, we will still provide you with the test as long as you meet the criteria.
Clarence, I think that's so important, the points that you're making about the educational piece, because that was a question. Will people get really good information about what happens during this process? And so you've indicated that there are a number of checkpoints where people will get education about what they should do.
Yes, very much so. And it starts with the appointment. When you call in for the appointment, that education process will start in terms of, your symptoms or whatever is going on, and then getting you scheduled to come out for your test, what transpires during that process. And once you get on site, you will be educated again about what is going to happen and what happens after the test, whether it's a positive or a negative test. And, people are anxious when they get tested, and they want the information back as quick as possible. And so we want to get it back as quick as possible. So during that process, if it turns out that you're negative, then that's great. We still will educate you about what that means. But if it turns out it's positive, then certainly we will direct you accordingly of the things you need to do to make sure that you're not infecting other people, possibly in your household or other people around you.
Thank you, Clarence. We're going to continue to follow up on this, because you said next week will be your first week and you'll learn some things. So we'll look forward to you coming back and giving us more details. The one thing I do want our listeners to know is that you provided an example, like a flyer that gives the details that we can make available, and then the individuals will be able to follow through on what you've shared with us today. So it's a lot of good information. We want to make sure that people can get the understanding of it through having a document. So we will make that available. And I know you'll have some of those when people visit with you.
Yes, very much so. And it's just great to be with you today.
All right. Thank you so much, Clarence. We got a lot to go. We got a lot to go forward here. We just want to go through our next slide, because we know that Hamilton is adding to what's already been going on. Dr. Tupper talked about this last week, and I like the way the organizations are working together. If you know, Clarence said that they would be open Hamilton Tuesdays and Fridays. Tuesdays and Thursdays. Monday, Wednesday, and we have a little typo here, forgive us. Monday, Wednesday, it should be Friday. Hurley is conducting their sessions at their testing at Atwood. And so we'll make that correction on our presentation. But Monday, Wednesday, Friday is at Atwood, and then Hamilton's going to pick up those other 2 days for the other areas in the community. So we appreciate that. Any last thoughts on that, Brother Clarence? For the testing, did you have one more thing you want to share with us?
Well, that was the main thing, Yvonne. We understand that the minority community has been impacted greatly, and we want to make sure that they have the access to the testing, and we want to try to get as many people tested as we possibly can. So please come on out.
Thank you so much. We want to move quickly to the Genesee County Health Department. Suzanne Cooper has been faithful and been with us every week. Suzanne, what are some updates from the Health Department? I know last week you told us about the tracing and the testing and the work that's being done on your end. So any updates for today?
Yes, so as of yesterday at 2 p.m., we posted to our website the number of test results in Genesee County. We have 1,390 positive COVID-19 tests with 145 deaths in Genesee County. And again, this is a reminder that this is not reflective of what's likely in our community, because we have had limited testing. So again, those of you who fit the testing criteria, and remember there is still testing criteria out there, we do encourage you to visit Hamilton or Hurley or speak with your primary care physician in order to be tested.
I do want to remind everyone that we are gearing up and planning for a second wave in the fall. And again, reminding everyone that there are many things that we can do now in preparation for the fall. And Yvonne has been a great leader in our community promoting flu immunizations. And when we think about the fall, we recognize that not only may we have COVID-19 again, we're likely to have flu. So we are encouraging everyone to think about getting a flu immunization and making sure we're adding that extra layer of protection in our community so we don't overwhelm our health system should we have a second wave. But we are working very hard on planning and doing this work in advance of a second wave, trying to make sure we reach every community member. So all the work that's being done in our community addressing disparity is so critically important, keeping in mind that we should be preparing not only for what we're dealing with right now, but what may come in the fall.
Thank you, Suzanne. Appreciate you so much for that update. I want to go back because we've got a question, Brother Clarence, if you can just unmute your mic right quickly. The question is, we're talking about testing, and maybe Suzanne, you would have some additional insights on this too. But the question from our participants is, what type of test is being offered at these drive-up sites?
Well, we have the nasal test. That is the test that determines whether or not you're infected with the virus. But we also have the antibody test. It's a little bit different, and it certainly tells you if you've been exposed to the virus. But the nasal test will actually tell you if you're infected currently.
Okay.
So both those tests we do have available.
Thank you so much. I know there's a lot of question around testing, and I think maybe one of our sessions we could just spend some more detailed time on that, because that is an evolving process.
Yes.
Learning about that. So those of you, yes, Suzanne.
I do want to remind everyone there is another testing location in Genesee County. It is the Rite Aide Pharmacy in Swarts Creek. Again, they're doing the same type of screening process because everyone must fit the appropriate testing criteria. That pharmacy is open 9 to 5. Their screening process is online on the Rite Aide website. They're not using the nasal pharyngeal swab, they're using a nasal swab. So just be aware of that. Also know that we are working on other testing locations in Genesee County, and as we have more information available, I'll be sharing that with you as well.
Okay, Suzanne, let's go back just quickly. What they're not using the nasal, they're using what kind of swab?
So there's a nasal pharyngeal test.
Yes.
So that goes a little bit further back into the nasal cavity. The Rite Aide Pharmacy in Swarts Creek is using a nasal swab. So it's a new test that Rite Aide is using, and they are using it at the pharmacy in Swarts Creek. If someone wants to be tested at that location, again, they're open Monday through Friday, 9 a.m. to 5 p.m., and the screening and registration process is done on the Rite Aide website.
Thank you so much. I just want to remind our listeners as well, there is an order or a priority level through which they are doing the screening. So just be mindful of that when you are seeking to get that assistance. We're gonna move quickly now. We also want to talk a little bit to the city of Flint. I understand Dr. Lawrence Reynolds is on with us this morning. Dr. Reynolds, can you give us an update from the city of Flint? Being able to unmute Dr. Reynolds.
Yvonne, this is Suzanne. Can I just make one more quick comment? There's been a lot of discussion about disinfectants.
I think we
We want to remind everyone, please do not ingest or inject a disinfectant product. It is not safe. And also do not experiment with ultraviolet light. Again, use your disinfectants based on the instructions on the packaging, and also be recognizing to be mindful about the use of of ultraviolet light and other products, again, use the instructions on the packaging.
Thank you, Suzanne. That is a really, really important insight. So we appreciate you providing that information. Dr. Reynolds, are you able to unmute? Okay, we'll come back to Dr. Reynolds. Let's move on to MDHHS, Michigan Department of Health and Human Services. We want to, oh, he is unmuted. Dr. Reynolds, let me give him one more opportunity. I'm sorry. Dr. Reynolds? Okay, I hear microphone, but I don't hear his voice. So let's move on to the Michigan Department of Health and Human Services. We have another guest with us today, Sharonda Grisby. She's a Flint resident, and she's been working hard for a long time to represent our community. She is a public health consultant at the Michigan Department of Health and Human Services in the Health Disparities Reduction and Minority section. Sharonda, can you just take a couple minutes and share with us what's happening at the state level?
Yes, thank you, Yvonne. And I have not changed my signature line. I work with Brenda in the Office of Equity and Minority Health.
Okay.
So that's a reminder for me to change my contact information line on my email. But I wanted to provide some updates for the state of Michigan. And first, I wanted to uplift the work that's being done by Mr. Oliver and Dr. Verholden in regards to the task force on racial disparities. Brenda wasn't able to join us this afternoon because we at the Office of Minority Health, we're going to be working closely with the task force, and she's leading one of the subcommittees, and she had to join that subcommittee, a meeting for that subcommittee this afternoon. But the updates I wanted to give from the state level that one, we've created some guidance on cultural and linguistic competence in the response to the rising needs to disparate living conditions faced by racial and ethnic groups. We developed those recommendations for organizations and entities to assist them in adopting, creating, and executing culturally and linguistic appropriate responses to COVID-19. There's two separate documents, one for the general public that talks pretty much about keeping yourself safe in respects to hand washing, disinfecting objects and surfaces, and distancing when living within shared spaces. It also includes information around face coverings and provides 3 examples of how to make homemade face coverings. And we also included in that guidance a step-by-step video from the U.S. Surgeon General on how to make homemade face coverings. The second recommendation is intended to address community-based organizations, and it gives information on what the state and local communities can do in response to COVID to make sure actions are culturally and linguistically competent. And it gives different information such as guidance on implementing and institutionalizing the national class standards, the use of plain language and consider preferred terminology. And it gives a host of other resources, and those guidance documents are available. I can share those with the group. The second update I wanted to provide was on the Office of Equity and Minority Health just recently released a request for proposal. The application seeks to support culturally and linguistically appropriate community-level projects that build community, identify, and implement programs, policies, and practices to improve the collection and accessibility of related to race and ethnicity, to address social determinants of health that contribute to health inequities, and to ensure equitable access to healthcare, quality healthcare, and strengthen community engagement, capacity, and empowerment through health equity, social justice, and cultural competency training. There's $210,000 available for the funding. It's a 3-year funding period. We anticipate funding up to 6 grant awards. There is a pre-application conference call that will be held on April 29th at 3 p.m. And the deadline for the application is May 29th.
So Sharonda, all of the information that you're sharing is available on the website for the department?
Yes. We did send out it is available in eGrams. If you visit eGrams, you can access the funding announcement there, and along with instructions on how to apply for the funding award. And then it'll be on Michigan. We are posting it on michigan.gov/minority health.
Thank you, Sharonda. We appreciate it. I know as it always happens, we get really short on time, but we want to thank you for those updates and know that there is a phone number on the slide here for any information hotline people might need about COVID and the updates that are being done through the state. So we appreciate you being on with us today, Sharonda.
Thank you, no problem.
I need to go back quickly to the city of Flint. I understand we have a couple of updates. Dr. Reynolds is back, he's unmuted, and we also have a quick update from Billy. I am going to ask you, in the interest of our time here today, if you could give us those quick updates and help us to understand what we need to know from the city. All righty then. We're still having that little issue. So let's move on to the Greater Flint Health Coalition. We have been one of our organizations in the community that's been providing a number of services for many, many of our residents. And so we have Nicole Smith-Anderson on with us today. Nicole, can you give us updates from the Greater Flint Health Coalition?
Yeah, absolutely. I just wanted to remind everyone that we are very much so open and working remotely. Actually, in the last month or so, our chat program has served about 1,200 clients remotely, doing a lot of education about COVID-19, making sure they're connected to their medical home, helping them, really with any social determinant of health needs that they have. So if anyone needs some assistance with that, I would definitely encourage them to reach out to our chat program, and that number is 810-953-CHAT. We also have a lot of programs that are open and operating as well. We can help with insurance enrollment. We also help with the Flint registry. So if anybody's at home and they've pre-enrolled in the Flint registry, but they haven't completed their survey yet, now is a great time to do it. They can just go to flintregistry.org or give them a call to get their information.
Thank you, Nicole. We've been talking about the registry for a while. We want to make sure that our community really understands the importance of the registry and how it will help benefit our community. Do you have any other insights you'd like to share about that?
Yeah, we really are excited for people to complete the survey, because one reason is we want to make sure that they're connected and they're supported. Once you complete your survey, it allows us to connect you to resources that you may need. So we're looking at things around lead exposure, health, child development, and nutrition. And so we really just want to encourage people to complete those surveys as much as possible, because it helps tell our story as a community as well.
Thank you so much, Nicole. Next, we want to just remind you, Mass Transit Authority, we call them MTA, they weren't able to be on with us, but they wanted us to remind you that their fixed routes are still being held. They are still being suspended until further notice, but your ride is still in service for essential trips only. However, you can still call your ride if you have individuals who need that service to get to the doctor or to get to groceries or to the pharmacy. They are still available. The number here on the screen is 767-5541. So if you are needing that service, know that they are still available. There is a small cost. They've reduced the fare to $225 each way, so that would be $450 if a person needs to utilize that service. So please continue to share that with our community members. In addition to that, our community schools and the GISD, they're really busy trying to make sure that all the services are available for the children, but they wanted us to remind you that the food is still being supplied. Each district has their own method of distribution. So whatever district you're in, be sure that you let your members in your community know that this service is still available. We want to go quickly now to Jim Melanowski of the Genesee Health Plan to give us a quick update for what's happening at the health plan. Jim, are you unmuted? Talk to us today.
I hope you can hear me. Can you hear me, Yvonne?
Yes, we can.
All right. Well, just a couple of things. Suzanne mentioned it, and I want to talk about it real briefly. The flu season's coming up here in the fall, and the Genesee Health Plan has done an ongoing drive-through flu clinic. So look for that. More information coming up, towards the fall. But we want to encourage people to get their flu shot more than ever this year, and so that'll be available at the Genesee Health Plan. We usually do it in October, but we might move that up this year. So just look for that. And then we were talking about disparities, and I just wanted to highlight really quickly that we do have someone who works very closely with the Hispanic community. We have a bilingual health navigator, Perlita, on staff that can assist those that have a language or cultural barrier, especially with speaking Spanish and interpreting and making medical appointments. So again, just call that number that's on the screen, 810-232-7740, and they can ask for Perlita if they need assistance with that group. And also then any type of enrollment services into healthcare. No one should not have any healthcare during this time coverage, so we can help with that.
Thank you, Jim. As you were talking, we did get a question that came in. This is back to MTA, and they're not on the line today, but what we want you to know is that question about your ride, will they transport to testing sites? We will inquire, because they did ask us if there are any questions, and get back with them. We will inquire and let them know this is a question so that we can provide that information for you. Always feel free to call their office, and they would be to call that number, and they will be sure to give you that feedback. We're going to prepare to hear from Dr. Susan Wolford, but I do want to go back to something before we get too far in our closing, is to Isaiah Oliver and to Dr. Deborah for Holden. Some of our participants are interested in understanding a little bit about those disparity questions, and one of those is, are there minority advocates assigned inside the healthcare institutions to ensure racial disparities are being addressed? And I just think we want to let you know that there's going to be a lot of work that's still got to be done. So maybe Isaiah, you and Deborah can give us a little more insights on, for these questions, how would you like people to get information to you that you can then share with those persons you're working with at the local and state level task forces?
So I will put my email up in the Q&A. I've sent it to a couple of people personally who've reached out during this webinar. I've had a lot of calls and emails from people in the community at large saying, are we doing this? Are we doing that? Can you advocate for this? I'm happy to receive all of that. I raised my hand for this job. Know that much of what you all are thinking about, we are putting forward. The task force does meet today at 3:30. I don't think there's anything that's been raised by this group that is not on the list of things that we're considering. But if you'd like to reach out to me personally as a task force member, I'll put my email up, and it's holdenc3@msu.edu. I welcome the opportunity to hear from our people and make sure that the great ideas and the things that we want to see are coming forward on that task force. The short answer to the question is no. There was nothing like that in place before COVID. There's nothing like that formally in place now. And that is one of the things on this, very important, actionable list of things we could be doing right now to ensure equity, is having trained advocates in the system of care right now. It's currently not happening, but it is something that's being considered.
Thank you, Dr. Deborah. And I'm sure that there are going to be many more questions, and this will be an opportunity for you to express those questions. So we're going to ask you to put them in the chat. It will give our panelists time to even respond to those. We'll hold the line open a little bit for them to answer their questions even after we close today. I want to move to Dr. Wolford. We've tried to have a clinical update for you, and she has an amazing conversation to have with us in the next few moments. Dr. Wolford.
Thank you so much, Yvonne. Can you hear me?
Yes, I can.
Excellent. It's important also, can you see me? Is it my slide or is it my video?
I see your beautiful picture right now on the slide, but we can see, there you go, yes.
All right, wonderful. So thank you so much for this opportunity to give a call to action. The call to action today is very brief. It is to love your lungs, to look after them. Because what you're looking at here is not a picture of celebration balloons, like many people thought it was. It is, in fact, our lungs. It's the alveoli, the small sacs in our lungs. And these alveoli are under attack by the COVID virus. This is what it targets. And why that's so important is because the surface of these little sacs is very thin. It has to be very thin because oxygen needs to make its way down the airway into those sacs and through that thin wall into our blood vessels. If anything obstructs that transfer of the oxygen from the alveoli through that thin wall to the blood vessels, we don't get oxygen going to the rest of our body. So things that obstruct that. Number one, smoking. If you smoke, show your lungs some love and try not to, because smoking really causes irritation, inflammation in there, and that hampers the transfer of the oxygen. It also stops the nice cells that work in the airways to get all the junk out of our lungs. It paralyzes those cells. So the first thing you can do is to stop smoking. And if you can avoid it, don't be around, don't be in the face of smoke so that you're not getting secondary exposure. And when I say not smoking, I'm primarily talking about tobacco, but we believe that vaping and marijuana smoke also it injures that area I'm talking about and will also have negative effects.
Thank you, Dr. Wolford. So our call to action is, if there's just one thing we can do this week, well, it's in two parts. Stop smoking or vaping or whatever we're doing. And the second thing is to be careful about who we're around if that's happening. I know sometimes as we close the day, we're in congested spaces. We can't always do all the things that we want to do, but let's be mindful that we want to protect and prevent the COVID spread. You can tune in and stay connected with us by subscribing to the YouTube channel. Thank you so much again, Dr. Wolford and all of our panelists at Healthy. And so subscribe to our YouTube channel, like us on Facebook, or even email your questions in, and we'll continue to try to answer them for you. It has been a pleasure again today to have you join us. We want you to just complete the survey that you will find at the end of the webinar today. And we've got one more week coming up. We'll be with you next week, and then we'll continue to give you updates about how the webinars will go. But we, again, today, on behalf of the Healthy Flint Research Coordinating Center's leadership, we thank you for joining us. We look forward to seeing you again, and thank you for doing all you do to make a difference in our community.